This is a special report from News 3 WSIL.
Hello again, I'm Julie Williams. Tonight we continue our COVID conversations. We want to get to the heart of COVID-19's impact here in our region and what it means for you. For tonight's conversation, I'll turn it over to my co-anchor, Mark Kiesling.
Thank you, Julie. We are joined tonight by Dr. Josh Miksanek of SIH. And Josh, thank you for being with us tonight. Now, you are an ER physician, correct, at Heron Hospital?
That's correct. I've been at Heron for 10 years, and I serve there as a medical director.
Okay.
I've been running lead on a lot of the COVID initiatives that we've been doing for the last 18 months, it seems.
So let me ask you, what are the typical procedures when somebody comes into the ER with COVID-19 symptoms? What kind of protocol do you go through for them?
Well, I mean, the first is to try to make sure they're isolated from other patients whenever possible. And so that means for people even with other colds that are going around right now, we're going to be extra careful with protective gear and putting them in the right rooms. Then we'll be running usually a battery of tests to confirm, one, that they have COVID unless we already know that they have it, and then other things like x-rays to see what the effect is on their lungs and blood work. The x-ray seems to be one of the more important things, but COVID does a lot of other things to the body and can affect the kidneys or the heart or other things, and so the blood work will help us to figure out how sick they are.
So are there certain symptoms that you look for that are kind of like telltale signs of COVID-19 that you know this person needs to be hospitalized rather than we can send them back home and tell them to rest at home and report back?
Yeah, I think, you know, what COVID kind of looks like to me now as an ER doctor is kind of like the flu. So people will come in with all various symptoms: cough, sore throat, runny nose, vomiting, diarrhea, pains, chest pain, stomach pain, trouble breathing, coughing. But what really helps determine whether they're going to be admitted for the vast majority of patients is its impact on your ability to breathe. And so feeling short of breath is very common in COVID patients. Dropping your oxygen levels is less common, but that's what typically we're looking for to hospitalize a patient. Rarely it will do other things to you in terms of blood clots or your kidneys or your heart that might require, or even dehydration in some patients to hospitalize them, but the vast majority are being hospitalized for their breathing.
And you mentioned the x-ray of the lungs. What does that show you? What are you looking for there?
So COVID's come to have a kind of telltale x-ray for us, and it's bad. I mean, it's something that a doctor would typically see and say, oh my, I mean, this doesn't look good for this patient. The shocking thing with COVID is I'm not used to seeing x-rays like this in my career outside of ICU patients on ventilators. And patients with COVID can walk in with these x-rays and they're still talking to you. And it's kind of shocking that it can look so bad. And basically, usually an x-ray will look mostly black because the lung is just air and the x-rays penetrate it. But when it gets inflamed from the COVID, it kind of whites out. And so when we see that kind of white out, which people would call a pneumonia, but I think it's a little different than when people classically think of a pneumonia. I think there's a lot of confusion on that in the lay population, like, oh, I don't have COVID, I have pneumonia. But most of the time the pneumonia is the COVID. The COVID is damaged and inflamed and destroyed some of the lung tissue, and it looks like pneumonia. That's how x-rays would always look when they're damaged or inflamed.
Now, how bad does it have to get before someone then goes into ICU and is placed on a ventilator or needs more severe types of treatment?
And that's a good question. So, especially now, because our ICU capacities are limited. And so typically ICUs are reserved for patients that need very aggressive care. So typically, you know, nursing ratios to patients are really one of the hallmarks of ICU care. That in ICU, you're almost one-on-one in some cases with a nurse, or two-on-one. And so people that need ventilation support, meaning they need to be on a machine to breathe for them, will always go to the ICU. People that we anticipate in a short period of time may require that, we'd rather have an ICU where they can be monitored closely and not find them in major distress. We want to keep an eye on them very closely before they would get to that point. So we'll have some people that have things like BiPAP. I know a lot of people are familiar with that because people wear CPAPs at home. It's a little more aggressive form of helping get air into your lungs. So people that are on that and kind of maxed out or towards the higher end of how far we can go with those treatments, we would like to put them in the ICU to monitor them more closely. Most of the time it's breathing. Sometimes it's other things. Your kidneys could be shut down or heart attacks. Your blood pressure could be low. Those are less common reasons for a COVID patient to be ICU. Those are very common reasons for people before COVID to be in the ICU.
Now, we've been hearing numbers around the area of ICU beds becoming more and more rare to find because so many of them are being taken up by COVID-19 patients. Now, what happens if you're in the ER and somebody comes in and they need to go to ICU and there are just no beds available for them?
This is a real challenge we're struggling with locally, but really everyone in an area that's being hit by COVID and the Delta variant right now we're struggling with. So there's nowhere for them to go. That, historically, if we say had a bad flu season and we got short on ICU beds, we might transfer some patients to other hospitals that had capacity. But what we're dealing with now is I called a large hospital, a couple hours away, and they said, we can't even talk to you if the patient's not established here. So the problem now is everywhere's overwhelmed, and so those patients stay in the ER. And they need one-to-one, nursing to patient ratios, and that's going to slow things down for people in the waiting room. And we've had a lot of, comments from patients. It takes a long time to be seen, and that's a big part of the reason is we're stretched to the brim to take care of these sick patients in the ER as well.
Now, we received some new numbers from SIH today, and we want to share these with our viewers. It's showing all of the current hospitalizations from COVID-19. Now, it showed 73% of the people who are hospitalized right now are unvaccinated. When it comes to ICU and ventilator cases, that number is closer to 95% of those people are unvaccinated. That seems to indicate that the vaccine is helping to prevent the more serious cases of COVID-19. Do you agree?
I would say that's been my personal experience in the ER. I was trying to just keep track personally over the last few weeks, and I felt like I was seeing about 8 or 9 to 1 ratio of unvaccinated to vaccinated patients. And so it does seem to be having an impact, just even in the ER where I'm discharging some patients that I'm seeing. I know I've admitted a few patients with COVID that we test every patient that gets admitted for COVID that weren't being admitted for COVID. They're admitted for broken legs, and maybe that's related because they were weak and fell down, but they weren't sick with COVID. They just tested positive, some of those that are admitted. The ICU and the ventilated patients are definitely from COVID, but far and away the vaccine so far seems to be highly effective at keeping you from dying and keeping you off the ventilator. Not nearly as well as prior to COVID, where I really felt like I had a force field around me from COVID. It's not 100% effective now in terms of things, but man, I'm so much less stressed being at work, taking care of so many COVID patients being vaccinated than I was back in the winter.
Oh, I bet. Now, the FDA has just fully approved the Pfizer vaccine, not just for emergency use, but have fully approved. Do you think that approval will convince more people to get vaccinated?
I like to hope it will. I think that the people that are left that are unvaccinated, I think, fall into probably two camps, those that are on the fence, and I think some of those might be swayed by a full approval, and those that are just adamantly opposed to it for various reasons. And I think it's really unfortunate to me that it's become a politicized issue. I wish people would trust us in the healthcare field, the vast majority of which doctors are vaccinated. They trust me when they come in sick with COVID, and I wish they would trust us because I'm seeing it firsthand, and it's really hard as a doctor to look at those unvaccinated people and say, I really don't have much for you. We have supportive care. We put you on a ventilator until your body can hopefully clear it. There are a few treatments out there. They're not like antibiotics for pneumonia. They aren't like, we give you this and you're gonna be better every time. They help a little, they don't help a lot. And so it's really devastating for me. It's very hurtful to see these patients and not feel helpless sometimes.
So what would you say to those people who are on the fence and trying to decide now whether to get the vaccine?
I mean, I would say I got it. I would say, I'm a skeptical person, and I'll admit I didn't get it in December, as most of my colleagues ran to the vaccine line. I wanted another month or two to get a little more data, and I had no question, even in December, that the vaccine was highly effective. We think of the flu vaccine, it's 40 or 50% effective. The COVID vaccine with the initial strains was 95%. I mean, this is fantastic. But we still didn't have a full safety profile, and so by March I felt really good about it. I felt like we've given it to millions of people. I haven't really seen anything myself. I've seen a couple people come in vomiting after it, or a little flu-like, and they were better the next day when I called to check on them. And so I really felt like the safety question was answered. And since March, when I got it, 100+ million doses have been given to people, and that still holds true. I can't really count, even on less than one hand, the amount of people I've seen come in with issues related to the vaccine.
All right.
I can on more than one hand the people that haven't been.
True. Dr. Miksanek, thank you, and we will check in with you again in just a few minutes, but first we want to toss it over to Julie for some statewide numbers.
Yeah, thank you, Mark. We'll go ahead and take a look at case counts in the states we cover. We'll start with Illinois here. Tonight, they report more than 3,000 new COVID-19 cases, and with those, 8 new deaths. In Missouri, they say an average of 1,600 new cases are reported every day. In Kentucky, they report 2,500 new cases, and with those, 17 new deaths. Tonight, Kentucky's 7-day positivity rate is at 12.8%. And tonight, Pfizer's vaccine has full FDA approval, and health officials hope that will encourage more people to get the vaccine. It may also give the go-ahead for more vaccine mandates. Jamie Graydon has more.
Those who've been waiting for full approval should go get your shot now.
A critical step to get more Americans vaccinated. The Food and Drug Administration has now granted its first full approval of a coronavirus vaccine 9 months after the first dose of the Pfizer BioNTech vaccine was administered in the U.S.
Their efforts to move as quickly as possible have in no way sacrificed scientific standards or the integrity of our process.
The vaccine has been authorized for emergency use in the U.S. since mid-December for people age 16 and older. In May, that authorization was extended to people 12 and older.
There you go.
While some health experts say the decision may motivate people still hesitant to get the shot, others are not so sure.
What I worry is that they may just come up with another reason for why they don't want to get it.
Full approval allows Pfizer to advertise the vaccine, which will be marketed as Comirnaty, and opens the door for more businesses, schools, and officials to issue vaccine mandates. Monday's move already having an impact. Mayor Bill de Blasio announced a vaccine mandate for all New York City school staff.
Vaccine mandates do have an impact, especially in people who are on the fence. It protects other people, protects people in your family, protects people at your workplace. That's another important reason to get vaccinated.
This all comes as vaccination rates are starting to tick up. Last week, the U.S. reported more than 1 million daily vaccinations for 3 days in a row. I'm Jamie Graydon reporting.
More than 170 million Americans are fully vaccinated. 92 million of them got the Pfizer vaccine.
We're joined again by Dr. Josh Miksanek, an emergency room physician at Heron Hospital. And earlier we touched on vaccine hesitancy. And what we're seeing right now across the country with this COVID-19 surge is it's primarily a pandemic of the unvaccinated. And that's what you're seeing in the ER, correct?
That's what I'm saying. I am seeing a few breakthrough cases here and there, which generally speaking, I personally haven't had any that were very sick or severe, but I know we've had a few in the system. But mostly, by and large, it's been unvaccinated patients.
What kind of strain has COVID-19 put on your ER department?
I mean, even here in a small ER, it's been an immense strain. And, practicing in the emergency department is a stressful, chaotic environment on a good day. And when you have resources, and when I became a doctor, I never thought in America I'd be resource constrained like they are in other parts of the world. And it's just exhausting to have sick people and not have what you need to take care of them many days. And it's wearing us down, and it's tough. And it's tough to not be able to send people that are sick to tertiary centers far away because they don't have capacity. And it's been rough. It's been very difficult.
What do you say to your staff when you see them getting worn down from dealing with this day after day? It's been 18 months now.
I'd like to say just try to pretend we're back in July, because I think we all felt pretty good back then, and the vaccines were working, and I felt good then, and I'm running out of things to say, honestly. I think typically people would describe me as a happy person. I come in, I'm positive, I try to elevate everyone around to be positive, and I'm running out of energy to be positive too. It's wearing, I think, not just me, not just us locally, but all across healthcare. People are just walking out of the job, and that's one of the things we're dealing with, even locally, is a nursing shortage. And it hasn't really become a physician shortage yet, but across the country, hospitals are struggling with no nurses who they're exhausted. It's been tough, and they've been the ones at the bedside more than we have, holding hands of loved ones when the loved ones weren't there in the first waves, and it's taken a big toll on them. So I'm running out of things to say. And honestly, people keep talking about resources for healthcare workers and that they're burnt out and exhausted, but there's no magic fix other than less COVID.
Yeah. Now, what people should be coming to the ER? Like, if we had to give some advice to people, because I know some people still consider that's where they go if they need a doctor. They have some kind of a mild infection or a cold, and they say, oh, well, I'll just go to the ER and they'll fix me up. Especially with this crunch that you're having, who should be coming to the ER and who should be going to their family physician or going to an urgent care center?
Yeah, sure. So, I mean, that's something typically I'd always say cast a wide net. If you feel sick, come in. Now I think at times there's going to be some people that don't have the best experience coming in, because if you're not very ill, you'll likely be discharged home pretty quickly after arrival. And so the real big things we're looking for is trouble breathing. And so a lot of people have themselves or family members have a pulse oximeter, which is a device you can put on your finger and check your oxygen level. We typically won't admit people that are above 90. So if you're short of breath and you're above 90, it's unlikely you'd be admitted. Now, some of those patients may have blood clots or other things. So if you're very short of breath or you're having a lot of chest pain, I would really recommend you come in, and we would love to see you for that and make sure that you're going to be stable. You might still go home, but I think the breathing is the real concern. When it comes to dehydration, I'm seeing a lot of people come in, I haven't been able to eat much for a week. And with the flu, I saw that all the time. I'd give them a bag of fluid, they'd feel so much better. I'd feel good, they'd feel good. With COVID, there's some question whether if we give too much fluid to people that are dehydrated, will it make their lung issues worse? And so we're a lot more judicious on the fluid we give them. And so I'm really not giving fluid unless people are really, really dehydrated in terms of their blood work. So just not eating great, not a good reason probably to come in, because a lot of us aren't going to give you that fluid, which you'll feel better for, but we worry about making the lung issues worse, which is what is killing people.
Okay. And again, what message do you have for our viewers as this battle with COVID-19, it just seems like it just keeps dragging on?
I mean, you trust us to take care of you, when you come in sick to the hospital. And I think by and large, you're hearing physicians say, please get vaccinated and help us out. It's not just the COVID, and I know a lot of people are like, I'm young, I'm healthy, I'm not gonna die of COVID. They don't tell you on social media, the flu, you feel bad, like you're dying for 2 or 3 days and then you're better. But I have so many people come in and they're just like, I can't take it anymore. I've been so sick for 10 days, make me better. And I'm like, I have nothing for you. And so there's a lot of people that are just suffering for weeks, feeling terrible and recovering. But it's also your grandparents, they have a heart attack, I have no bed for them. It's your loved one that has cancer. St. Louis can't help them if they get sick. And so we really need everyone's help. And even if you won't get a vaccine, and I would love you to, there's other things you can do to help us out. I'm not trying to shut things down, but maybe don't have a giant birthday party, and create a super spreader event for us, or just use some common sense like that and help us out during this period of time where we really are in a huge deluge, and we really could use all the help we could get from the community.
All right. Dr. Miksanek, thank you so much for joining us today. And we will have this interview and much more on COVID-19 on our website, WSILTV.com.